This is Dr. Koller from Tulane University. This is our video abstract for methods for managing erectile function in cis and trans male patients after neophallus reconstruction. The number of patients seeking gender-affirming procedures is increasing annually, and more procedures are being covered by both private insurers as well as Medicare and Medicaid. For instance, there's been a threefold increase in coverage by Medicare from 2012 to 2014, and this trend continues to rise. Reports say that roughly 72 to 84% of patients who underwent gender-affirming surgery also had a genital procedure. Hence, the demand for qualified surgeons to perform this will only increase with time. In this review, we focus on preoperative evaluations of patients with neophalluses, some of the considerations to decrease overall complication rates, as well as some of the challenges with placing penile prosthetics in this specific patient population. We review different techniques published in the literature, as well as different implants used. We also describe an experimental anchoring technique that implants proximally using the pelvic rami, as well as summarizing published outcomes in patients who have undergone prosthetic placement. The review also contains some MRI images used in preoperative management of patients. Here we see a patient who has a complication from poorly controlled diabetes resulting in a total penectomy. We will review the importance of perioperative imaging, especially in cis male patients where you need to establish anatomical landmarks prior to reconstruction and eventual prosthetic placement. As seen here, these intraoperative photos illustrate the traditional placement of an inflatable penile prosthesis into a neophallus. Here we see a cis male patient who lost his native penis after tricorporeal priapism. The patient required exchange blood transfusions secondary to sickle cell disease. Additionally, we discuss a new cataveric technique that was developed by Drs. Hellstrom and Alzweri from Tulane University in conjunction with Boston Scientific. The surgical approach uses advanced male slings that are passed in a trans-obturator fashion as anchors given the lack of proximal corpora in transgender patients. Lastly, we have outlined a table summarizing overall outcomes and complications from many of the large retrospective series in this patient population. We hope you read this review and find it useful in your practice.